Hello everyone, welcome back to my channel. I am Dr. Prabhat Singh, MD Anatomy from AIIMS Jodhpur. So in this video, we'll talk about Norma Basalis of skull, a very important. So हम skull को ऊपर से देख रहे हैं, that is Norma verticalis, Norma frontalis, Norma occipitalis, Norma lateralis, और एक नीचे से देख रहे हैं, that is Norma Basalis. Norma Basalis is very important because majority of the structures that are entering the cranial cavity, हेड एंड नेक के बीच के कनेक्शन सब कुछ यहीं से रिलेटेड होता है. ठीक है, सो लेट अस स्टार्ट विद नॉर्मा बेसालिस. तो ये कुछ मेरे यूजी डेज के अर्मीनिया के स्कल हैं, उनकी इमेजेस हैं विच आई हैड देम इन माय लैपटॉप. जिनको पता है मेरे लैपटॉप में जो अंदर जाता है कभी बाहर नहीं आता वो चीज़. सो आई एम यूजिंग दो स्कल्स टू डेमोन्स्ट्रेट. ओके, सो फर्स्टली वी डिवाइड द नॉर्मा बेसालिस इनटू 3 पार्ट्स. The anterior, the middle and the posterior. So is it clear? Let us start from the anterior. Okay, so in the anterior you have this that is known as the alveolar arch. This is alveolar arch. This is made up of maxilla. Now more important than that, this part that is the hard palate, we need to talk about this. So this hard palate is divided into 4 parts with the help of a cruciform suture. So this suture is a cruciform suture that is comprising of further subdivisions. This is intermaxillary suture. This is not inter but intrapalatine, and this is palatomaxillary. Some authors also call it as inter, so you can go for any, it doesn't matter. I'll tell you why. Because this part is made by the maxilla. ठीक है, and that maxilla is a paired bone. तो दोनों parts के बीच में बोले तो inter आना चाहिए वैसे तो logically. Even I'll go for inter then. And this part is made by palatine bone. So the hard palate is made by maxilla and palatine, the 2 bones, and these are the various sutures present in between them. Now, can you appreciate these openings over here? 1 large one and 2 small, 1 large and 2 to 3 small. The large one is greater palatine canal, जहाँ से greater palatine nerves and vessels pass करती हैं, and these 2 to 3 small ones are lesser palatine canals, and from the greater canals, the greater palatine nerves and vessels, they pass anteriorly like this. This is the incisive fossa, and this is the foramen, incisive foramen in the incisive fossa, and these nerves come out from here and enter the nasal cavity from here, the greater palatine towards the nasal cavity from here. Okay, so that is about the anterior part. Anterior part बहुत easy है, इतना ही है. But let us move on to the intermediate part. Okay, So in the intermediate part you have this bone. This is warmer, and then you have this bone. mm, this one mainly. This is sphenoid. Then you have this bone. This is temporal. So we will talk about these bones and the foramens in these bones for now. Okay. So this former, it has two alas, and its alas it meet the rostrum of the sphenoid, and over here on the lateral wall they form two canals. The canals are one with the palatine, palato-vaginal, and the other one is vomero-vaginal. These are the two canals that are formed over here. Now let us talk about the foramens in the sphenoid. Over here you have one foramen, and over here you have another foramen. एक यहाँ पर भी होता है पर वो base of skull से नहीं दिखता, वो सिर्फ canal cavity से दिखता है, that is rotundum. So for now we'll just stick with these two, that is ovale and spinosum. So what passes through ovale? Male passes through ovale and spinosum से men pass करता है. हाँ जी, male and men. Okay, female नहीं है unfortunately. So male stands for mandibular nerve, accessory meningeal artery, lesser petrosal nerve, emissary veins. Men stands for middle meningeal artery, emissary veins, and nervous spinosum. It's a branch of कौन सी nerve? Which trigeminal? It's a branch of V3. Mandibular nerve. Yes, समझो mandibular nerve. This is your mandibular nerve V3. Okay, and V2, that is the second branch of trigeminal that passes via foramen rotundum, जो cranial cavity से दिखता है, नीचे से नहीं दिखता. So I hope is it clear? Now let me check. So we have covered the parts of norms, and we've done the palate, we've done the bomber, we have done the incisive foramens. Next was the parts of temporal bone. Yes, let's talk about the parts of temporal bone. So that again I need to delete this. So the temporal bone comprises of squamous part, petrous part, and tympanic part. Let me firstly draw the outline of temporal bone so that आप लोग अच्छे से समझ पाओ उसको. So this is the temporal bone, more or less, somewhat like this. This is the temporal bone. Okay. Now this is the petrous part of temporal bone. This and this side से पूरा ऊपर से, that is squamous, and this over here near the extraordinary canal, near the mastoid, basically to be frank, near the mastoid, that is your tympanic part. So the three parts are squamous, tympanic, petrous. Moving ahead. Next topic that we need to cover in Norma Basalis is pterygoid plates and pterygoid hamulus. Okay, for that let me find some other image. Okay, so one is this and one is this. These are the two pterygoid plates. Let's have a link. This was also one over here and one over here. These are two pterygoid plates. Now this one is your medial pterygoid plates. These are the part of sphenoid. Medial pterygoid plate, lateral pterygoid plate. Now importantly, the lower end of medial plate is curved, and that is known as pterygoid hamulus. It's like a hook. Okay, so now we need to know किस पे क्या attach होता है. At medial pterygoid plate and pterygoid hamulus, combinedly it provides the attachment to tensor veli palatini muscle. The medial pterygoid plate separately also provides attachment. It provides attachment to pharyngeo-basilar fascia and superior constrictor of pharynx. Pharyngeo-basilar fascia, superior constrictor of pharynx, and tensor veli palatini. Hamuloid पे only tensor veli palatini. Now let us talk about the lateral pterygoid plate. So lateral pterygoid plate is having the lateral surface and is having the medial surface. The lateral surface provides origin to lateral pterygoid muscle. Medial surface provides origin to medial pterygoid muscle. So that is about the two pterygoid plates. Then I have already told about the foramens and the sphenoid. Now let us move on to the styloid process. And the spine of sphenoid. Firstly, let's cover the styloid process of temporal bone. It's unfortunately इससे ज़्यादा clear इस इमेज में थोड़ा सा दिख रहा है. This structure. Now this is spine. Not spine, sorry, styloid. It is spine-like thing, but it is known as can you see the structure? This is the styloid process, and this is the mastoid process. So mastoid provides the attachment to sternocleidomastoid, splenium capitis and longissimus capitis from its lateral side. From its medial side, it provides the attachment to digastric, posterior belly, origin, and insertion. Medial to the posterior digastric, you have the cranial nerve 7th that is passing. So the digastric posterior belly prevents the injury of the facial nerve. So that is very important. Okay, moving ahead. to the styloid. Structures attached with styloid are known as styloid apparatus combinedly. So, styloid apparatus consists of 3 muscles and 2 ligaments. What are the 2 ligaments? The ligaments are stylohyoid and stylomandibular. Stylomandibular ligament separates the parotid gland from submandibular gland. Now, what are the 3 muscles? The 3 muscles are stylohyoid, yes, muscle of the same name as the ligament. Stylo Pharyngeus, stylopharyngeus, and styloglossus. A muscle of pharynx, a muscle of tongue. So these are attached with the styloid process. So 3 muscles, 2 ligaments are attached with styloid process, and they are known as the styloid apparatus. Next, we will talk about this part. This is small projection. This is known as spine of sphenoid. It provides attachment to again something similar to the styloid apparatus. Styloid apparatus में क्या था? 2 लिगामेंट थे, 3 मसल थे. यहाँ पर उल्टा है, यहाँ पर 2 मसल हैं और 3 लिगामेंट है. अब मसल कौन सी हैं? मसल्स आर टेंसर वेली palatini, yes, the same which are attached to the middle pterygoid plate, and tensor tympani. Now, what are the 3 ligaments? Ligaments are spinomandibular, anterior ligament of malleus, and pterygomandibular. This is attached with the lateral pterygoid plate. So one with the lateral pterygoid plate, एक जाएगा मैंडिबल पे और एक एंटीरियर मेलियस जो कि यहाँ से अंदर जाएगा. कहाँ से अंदर जाएगा? We will just have a look. And the next point that is coming up is squamotympanic fissure. So this is the articulating facet for mandible. Mandible ka condyle process will articulate over here, and over here can you see this slit? I'll just erase it. We see the slit, choti si slit. This slit is known as squamotympanic fissure. तो इससे क्या पास करता है? इससे पास करती है quadrant tympani nerve and the ligament of malleus and anterior tympanic artery. एक इंपॉर्टेंट चीज रह गई थी, ये आपको जो स्पाइन ऑफ स्फेनॉइड था, स्पाइन ऑफ स्फेनॉइड के रिलेशंस medial and lateral. Medially you have the carotid tympani nerve and laterally you have the auriculotemporal nerve. So I'll just draw them on this side. This is your spine of sphenoid. So from here and from here 2 nerves are passing. This is the auriculotemporal nerve and this is the carotid tympani nerve. Then my favorite foramen lacerum. Yes, intermediate part ही चल रहा है अभी तक. So this is foramen serum, but prior to that let us have a look at this one. This is carotid canal. So carotid canal foramen सीरम में खुलती है, बोन के अंदर से जाके लेसीरम में खुलती है. एंड लेसीरम is not like this the way you're seeing it. It is closed inferiorly by a cartilage. Since bone processing में cartilage निकल जाती है तो वो दिख नहीं रही. It is closed inferiorly and carotid canal is closed superiorly. Now let us have a look how these structures communicate with one another. So this is foramen serum. This is the carotid canal. Carotid canal. This is the pterygoid canal. Which opens up. कहाँ पर कमेंट करके बताना. यहाँ पर जो अंदर की तरफ होता है ट्रायंगल, उल्टा ट्रायंगल क्या होता है कमेंट करके बताना. ओके. So from the carotid canal, internal carotid artery is passing. This is your internal carotid artery, and sympathetic plexus is wrapped on it. SNS plexus is wrapped on it. This SNS plexus gives off a nerve, nerve X, a nerve Y. Let's call this a nerve X. A nerve Y is coming from the cranial cavity, nerve Y, and finally they form the nerve Z. So nerve X is deep petrosal nerve. Nerve Y is greater petrosal nerve. Yes, एक लेसर भी होती है. कौन से फोरामेन से पास करती है? ओवेल से. मेल में था L. And the nerve Z जो X और Y को मिलके बनती है. So it is formed by X and Y, and it is nerve of pterygoid canal. And internal carotid artery also give a branch over here, and this is known as pterygoid artery or artery to pterygoid canal. सब समझ में आया? फोरामेन सीरम नीचे से बंदा है, कैरोटिड कैनाल ऊपर से बंदा है. हाउ आर दे कम्युनिकेटिंग? लाइक दिस. So internal carotid artery will go over here into something that is known as cavernous sinus. Now the next point that we need to study is carotid canal हो गया, foramen. So that is all about the intermediate part. Now let us move to the posterior part. Okay. So the posterior part. Posterior part में we need to सबसे पहले talk about the largest foramen of the skull, the foramen magnum. So this foramen magnum is divided into two by an alar ligament. So divided into two by the alar ligament, and it forming the two compartments, the anterior compartment, the posterior compartment. In compartment is small, and it is known as an osteoligamentous, and posterior known as the neurovascular. Osteoligamentous and neurovascular. So we need to know the structure that are present in it from anterior to posterior direction. So firstly, we will start with the osteoligamentous compartment. So in osteoligament compartment from anterior to posterior, you have three structures. The first is apical ligament of dens. ये क्या होता है मैं अभी बताऊंगा, just wait. Then the second is vertical band of cruciform. ये पैलेट वाला क्रूसीफॉर्म नहीं है, कौन सा क्रूसीफॉर्म है अभी बताऊंगा, जस्ट वेट. एंड द थर्ड इज टेक्टोरल मेम्ब्रेन which is the continuation of the posterior elongated ligament of the vertebral column. So ये हैं क्या चीज़ ये दोनों? So this is the cervical vertebra and this is the dens or the odontoid process. So a ligament is attached from the tip of this dens, that is the apical ligament of dens, and it is having a cruciform ligament which is having the vertical band, is having the horizontal band. So the vertical band of cruciform and apical ligament of the dens, they are present in the anterior compartment. Now the posterior compartment. So posterior compartment में न्यूरोवास्कुलर है, तो एक नर्व एक आर्टरी कुछ ऐसा सा ओरिएंटेशन है. तो आई विल यूज रेड एंड ग्रीन. सबसे पहले आएगा आपका नर्वस स्ट्रक्चर मेड्यूला ऑब्लोंगेटा अलोंग विथ मेनिंजेस. यस, स्पाइनल कॉर्ड नहीं पास करती फोरामेन मैग्नम से, मेडुला ऑब्लोंगेटा पास करता है फोरामेन मैग्नम से, याद रखना. मेडुला ऑब्लोंगेटा फोरामेन से पास करता है, उसके बाद में स्पाइनल कॉर्ड बनती है, नॉट इनिशियली. मेडुला ऑब्लोंगेटा विथ मेनिंजेस. Then you will have the vertebral artery जिसके along sympathetic plexus wrapped होने वाला है. Then you will have spinal accessory nerve का, बेसिकली एक्सेसरी नर्व का स्पाइनल कंपोनेंट ऊपर जाएगा क्रेनियल कैविटी में. ठीक है जी. Then you will have anterior and posterior spinal arteries, and then we will have cerebellar tonsil which is abnormal अगर present है तो, normal नहीं है ये. ठीक है जी. So that is about the foramen magnum. Now after foramen magnum what do we have? After foramen magnum we have the jugular foramen. Jugular foramen कौन सा है? ये वाला. Let us have a look in some other image. ये वाला दिख रहा है आपको जो ये zigzag सा जा रहा है? This was carotid canal and this is jugular foramen. Just draw it again. This is the carotid canal and this is the jugular foramen. Jugular foramen is having three parts. So jugular foramen is having three parts: anterior, middle, and posterior. So from the anterior you have the inferior petrosal साइनस. मिडिल पार्ट से आपकी तीन क्रेनियल नर्व्स पास करती हैं, क्रेनियल नर्व 9th, 10th, 11th. So 11th is having two components, a cranial component, a spinal component. Spinal component cranial cavity में जाता है through foramen magnum, then दोनों components meet करते हैं, eventually finally the nerve comes out to the jugular foramen. I'll just draw it also. And posterior वाले में आपके पास sigmoid sinus, it continues into the internal jugular vein. So what happens is foramen magnum, जुगुलर फोरामेन. सो स्पाइनल एसेसरी यहाँ से गई, क्रेनियल एसेसरी यहाँ से आई, दोनों निकल के यहाँ से आ गए. इट्स लाइक दिस द जुगुलर फोरामेन एंड क्रेनियल नर्व नंबर 11 की कहानी. सो दिस इज ग्लॉसोफेरेंजियल, वेगस एंड एक्सेसरी नर्व. ओके, देन द नेक्स्ट इज hypoglossal canal. Okay. For hypoglossal canal, some other image. Yes, this is the jugular foramen, जो बड़ा वाला दिख रहा है आपको. And can you see this छोटी सी opening over here? This is hypoglossal canal. इसके थ्रू क्या पास करता है? इसके थ्रू पास करती है आपकी cranial nerve 12, that is the hypoglossal nerve, and meningeal branch of ascending pharyngeal artery. Okay, then the last, that is this foramen. Hypoglossal canal is also known as anterior condylar canal. Why? So can you appreciate this articulating condyles for the first cervical vertebra? These are the condyles which are going to articulate with C1. So this is present anteriorly. This is your anterior right now, and this is your posterior. This is known as the anterior condylar canal, and similarly this is known as your posterior condylar canal. इसके थ्रू पास क्या करता है? इसके थ्रू meningeal branch of occipital artery and emissary veins. That's it. I know बहुत लंबा है, but that's it for Norma Basalis. Don't forget to like, comment, share and subscribe with your friends. Don't forget to follow me on Instagram and @ me by Dr. Prabjot or S. Prabjot. Bye bye. See you soon. Bye.